Welcome to the new and exciting video introduction and in-service of the GO-PAP disposable CPAP system. Let's begin by discussing the basics of our GO-PAP.
The GO-PAP is a fully disposable CPAP system that's manufactured in America. It utilizes the low pressure port set at 10 liters per minute. Unlike other disposable CPAPs on the market that use the low pressure port, our GO-PAP's PEEP settings are independent of the flow. This means that you can set it and forget it and focus on caring for your patient. There's no need to mess with manometers or continue to crank the flow up to higher levels. At 10 liters per minute, our GO-PAP will run up to 90 liters per minute of flow to your patient at 5, 7.5, and 10 centimeters of PEEP. Our device is made in America. Some might overlook this, but this is a great point to make as we create everything here which decreases shipping times and assures you that you are getting an American-made, well-tested, FDA-approved product. Every piece is touched, inspected, and tested by human hands.
The GO-PAP comes with the BiTrack ED mask, and it comes in two sizes, large and medium. Medium is the most popular size and will fit about 80% of your patients. The BiTrack ED mask is a floating mask and is designed to fit on the patient comfortably. When we tighten the mask, we don't want to over-tighten it. Over-tightening the mask will create leaks. And in fact, if you're experiencing leaks, it's actually better to loosen the mask and not tighten it further, as we're used to in other CPAP systems that you may have used. It is made from silicone, which will enable you to get an effective seal in the pre-hospital space. And it has an adjustable Omni-clip on the forehead to enable you to get a perfect fit. The straps on the outside are fully adjustable and can be secured using the Velcro once the patient has accepted the mask. You will also find with the BiTrack ED mask that you will be able to use nasal cannulas and capnography without affecting the seal.
So by now you're probably thinking, okay, you really haven't told me anything that makes this different than what I'm currently using. Well, here you go. It simply connects to the low pressure barb. You turn it to 10 liters per minute. You do not exceed 10 liters per minute. You set the PEEP and let it work. The PEEP is independent of the flow. You never have to adjust the flow to increase or decrease the PEEP pressure, which is the case in other devices. Plus, the flow is up to 90 liters per minute with an FiO2 of 30%. No manometers, no charts, over 40 minutes of runtime on a full D tank.
The GO-PAP comes with an integrated nebulization port, which is standard on all devices. It's a closed system until the canister is inserted into the device. Circuits have the option of coming with or without the canister.
Now, a full demo of applying and operating the GO-PAP with neb.
The BiTrack ED mask comes in its separate bag. Once you've taken the BiTrack ED mask from the bag, the GO-PAP will fit on the hub of that mask. The end of your O2 tubing will fit onto the end of the GO-PAP. You will then need to connect your O2 tubing to the low pressure port. After you connect the oxygen tubing, you will adjust your flow settings to 10 liters per minute. Do not exceed 10 liters per minute. Once you feel the flow come through the mask, you are then able to place it on your patient. We would recommend giving your patient time to adjust. Have them hold the mask to their own face. This allows them to ease their anxiety and to feel the oxygen at their face. At the top, place the straps up and over the patient's head. You will connect the mask at the bottom using the clips. Once you've placed the clips on either side, you will pull the Velcro to tighten the mask. Do not tighten the mask too tightly. Tightening the mask too tightly could create leaks around the patient's face. Our mask is a floating mask and it is created to float on the patient's face comfortably to create an efficient seal. One thing to note is that our mask has an Omni-clip feature. This allows you to move the mask in and out and up and down to fit your patient efficiently. Our GO-PAP comes with 3 PEEP settings. This PEEP, as stated prior, is independent of the flow in the tank. 5, 7.5, and 10 centimeters of PEEP will run accurately with 10 liters per minute of flow. If you choose to nebulize your patient, simply connect the supplied O2 tubing to a second oxygen source. Place your medication into the canister. You can use the top of the canister or the needleless entry port. Set your flow to 8 liters per minute. Once you see the flow of nebulization from the top of the canister, place the canister into the circuit and give it a slight twist.
In conclusion, this product is a simple approach to emergency CPAP with consistent therapy and independent PEEP. With a runtime of over 40 minutes on a full G cylinder and an FiO2 of approximately 30%, it provides everything your patient needs, even allows you to focus more on your patient care and less on patient settings. It runs at 90 liters per minute, which far exceeds your respiratory patient's inspiratory flow demands. With the GO-PAP and over 40 minutes of CPAP therapy, plus the ability to deliver nebulized treatments, you have the clinical capability to start CPAP at the point of contact and meet the demands of your CHF and COPD patients. Thank you for tuning into the GO-PAP in-service video. If you have any further questions, you can contact your clinical rep, your distributor, or you can head to www.pulmodyne.com.